Hi everyone, I'm Dr. Alyssa Watson.
And I'm Dr. Beth Molleson.
Thanks for joining us again in the Veterinary Breakroom. In the break room, Dr. Beth and I have short conversations about relevant topics in veterinary medicine. And this week, we are going to be talking about reversing the roles and being a patient instead of being the treating doctor. This came up because actually Dr. Beth and I both have had some recent doctor visits, and I know that for me personally, there's always kind of a running joke, kind of a stereotype, if you will, about whether or not doctors and nurses make good clients. And so I thought I would hold up the mirror and look at myself and see, do I really make a good patient? And I have decided that I definitely do not make a good patient. How about yourself, Dr. Beth?
You know, maybe I'm wrong. We'd have to call my doctor up, but I think I make a pretty good patient. Well, I think we also need to define what that means for us, because to me there's like a few different aspects. Like one part could be, are you one of those people that goes to the doctor regularly, or are you one of those people that could ignore a concerning symptom for years hoping that it goes away? I feel like that could be one definition of good or bad. And then the other one, of course, maybe is more like, are you compliant? Do you listen to their recommendations? Or are you the type that self-treats or self-diagnoses? So Alyssa, when you say you're a bad patient, what are you basing that off of?
Okay, so I definitely want to clarify. I am not a mean patient, so that is
Okay, good.
something that I think is very important. I am very empathetic toward all of the staff at all of my doctor's offices. And my main doctor, as we'll say middle-aged woman is certainly my OBGYN, and I had that appointment this week. And I love my doctor. I love my OBGYN. I will tell you, she is chronically late. And I sit in the room for generally over an hour waiting for her. And it's been a frustration over the years, but I'm always careful to remember that there are other people that need her time and probably, are a higher priority than me, oftentimes. And so, but I will say that what you were talking about, putting off care for yourself, that is something that I am really horrible at. And for instance, I got a script or a order for a mammogram from my doctor yesterday when I was in for my appointment. And I know I need to make that appointment to have my mammogram. And I looked back to see last year, and it took me 2.5 months from the time I got the order. In fact, I think I had to call my OBGYN's office and have them do another order because it expired. And so my goal this year is not to do that. I'm going to call and make the appointment for my mammogram, but just trying to fit in those appointments for my own care. The other thing, I need to go to the eye doctor. Since I turned 45, my close vision is very poor. I'm one of those people that, I ordered a bunch of readers off of Amazon instead of making an appointment and going to the doctor and getting my eyes checked. And I just have been making do for all that time.
I will say that's one area where I feel like I can't identify. I am the opposite. I'm like the hypochondriac that has a sore throat and immediately needs to be seen by the doctor to see if it's an abscess rather than it just being like a head cold. So I feel like maybe that impacts, I don't know, my big issue when I would say I'm a bad patient. And okay, let me ask you this question first, Alyssa. Do you tell when you're seeing a doctor, do you always tell them you're a vet? Or is it just at the point where your main doctors know already?
My main doctors know already. It's literally like the one doctor.
Okay, that's right. We're not talking about a lot of doctors
year,
here.
like, well, not anymore because it passed away, but every year she like used to ask me about her hyperthyroid cat, like every year, like during my exam. I'm like, this is
Mhm.
very uncomfortable. Can I get dressed and then we can talk about your hyperthyroid cat?
I know. I feel like I've answered a lot of vet questions during breast exams. I don't know if the doctors feel like it's a time to make you feel more comfortable. But anyway, the reason I ask is because my primary doctor, again, back to my hypochondria, he always says to me, he knows I'm a vet. And his dad was a vet. So I think he likes that connection. He likes that I have that medical background. But he constantly says to me, you are not allowed to diagnose yourself. You need to let me do that. And he means that from a place of compassion where, I go in and I'm like, probably this abscess on my tonsil. I bet I'm going to need it drained. And I bet I'm going to be septic and all of that. Like, that's where my head goes. And he is like, no, as far as you're concerned, all you have is a sore throat. You need to come to me for any additional thoughts about it. You cannot be diagnosing yourself, which I feel like is very sweet. But that's where I'm the bad patient is I'm the Googler. I try not to like admit that to the doctor. But again, I'm the person that like comes in thinking maybe they have ideas. But I don't think, like you, I think being in the healthcare field on the veterinary side of things, we at least have that compassion about what doctors go through in a day, knowing that their appointments are 15 minutes, knowing that the wait staff has the wait staff that the help that the assistants and nurses have been yelled at by different patients throughout the day. I think that compassion brings a lot to it and makes us better patients, I think, in that regard. But at the same time, I do sometimes feel like that medical knowledge can make it a little tricky, especially let's go back to the self-treatment. Are you like I'm going to diagnose and self-treat type of person?
I feel like I have I'm in a very special circumstance there because my brother is an ER physician
Mm,
and he also lives here
mhm.
in town. And so we've kind of created this symbiotic relationship between the two of us where if he needs anything for his pets, he calls me. And if I need anything for myself or the kids or oftentimes my husband, I'll call him and be like, this is what's going on. I need a Z-Pack called in. Can you do that for me this morning?
Oh, that's a nice symbiotic relationship. Do you feel like having him as a brother makes you a better patient, or how do you feel like that affects your relationship with human
I
healthcare?
actually do. I actually do. Again, just from the standpoint of I know what he goes through and
Mhm.
he'll call me up and tell me about a particularly difficult day or something that happened and it gives me a lot of empathy for especially people in ER medicine right now. And so uh so yeah, so I think that does make me a little bit better patient from that standpoint. Again, when you're talking about like what is a good patient, I
Mhm.
think just being a good person is
Really all the doctors ask for,
really
or all they
exactly.
want. Yeah, at the end of the day. I feel like the other I don't know that this would qualify as a bad patient, but I feel like where being a vet impacts my relationship with human healthcare, I feel like it gives me more it's almost like too much. Like that not all doctors are created equal. You know that mistakes happen. You know that the staff may not be fully trained. You know that these people are overworked and busy and maybe don't know everything. I feel like it adds to my anxiety. Well, again, we've established that I'm anxious about health in general, but it almost like I will see friends be like, "Oh yeah, the doctor said X, Y, or Z," and they kind of take that as fact and don't give it a second thought. And I'm over here like, "Oh, not all doctors can be trusted. What if they're too busy? What if they don't know what they're talking about?" So I don't know. Something about I think knowing too much but not enough that puts me in that weird spot when it comes to diagnostics too. So
Yeah, I think that that's a really good point. Another place that I find myself sometimes being questioning things is billing and money because I'm like, okay, that like pill of Tylenol should not have cost $50.
yeah, That's a really good point. I took my 3-year-old to the pediatrician because he just had a slight fever, but I knew that the flu was going around in his classroom. So I wanted to be proactive about maybe, again, proactive with my healthcare visits, but wanted to, consider Tamiflu if it was the flu. So I took him in. I think they wound up doing a flu test and a strep test because his tonsils looked a little red. And long story short, he did have the flu, but that visit cost $500, and I just was shocked at the cost. And the flu test was broken down into 2 different line items on my bill. Like it was like 2 different quick view flu tests. But I know that the quick view flu test is just one test, but because it tests for 2 different strains, they bill you twice. So yeah, there are instances like that where I'm like, it would be better off if I just paid this, didn't try to compare what it would be for a quick visit in my office, all that good stuff. Because of course that's comparing apples and oranges when it comes to cost. But I'm with you. It's like, yeah, you see the Tylenol cost $50 and makes your skin crawl.
So it does kind of bringing us back around to the top of the episode, it does kind of make me perhaps step back a little bit and give those doctors and nurses that come in a little bit more grace because they're probably just going through all the same things that we're doing.
I'm with you. In fact, I was at the doctor yesterday and I walked in and I could tell there was like tension in the waiting room that as soon as you walked in, and there was a patient who was unhappy about something and being quite rude to the staff. And I just, my first thought was like, oh, I wish I would have like brought you guys donuts or I don't know, brought you something, because I know that feeling and I know how demoralizing it is. So I think, again, that just brings us back to the compassion point. And I think that in a lot of cases, no matter how we define it, makes us better patients, I like to think.
I like to think
but
so.
We need to get your brother on here and ask.
We should. We absolutely should. Well, I think that brings us to the end of today's episode and our win of the week. I'm going to keep it very themed, and my win of the week is that I got my annual done out of the way. My annual doctor's visit early. I only had to reschedule it twice this year, which that's like a record for me.
Nothing. Yeah.
And my doctor was great and on time, and I only waited in the room 52 minutes. So that is like the biggest win for me.
Have you seen that meme that's like, how long, I don't know if it's a meme, but whatever, a tweet, how long would you wait naked in the exam room waiting for your doctor? For me, it's 7 hours or something. For those of us that are people pleasers, I think we can all relate to that. So I'm glad it was only 52 minutes for you.
Yep. How about you? Do you have a win this week?
Yes, I'm going to keep mine on theme too. This might be TMI for some of our audience, but I got my colonoscopy yesterday. And anybody that hasn't been through it is probably, like whatever. Anyone that has been through it knows that is a feat, because it is, well, I shouldn't scare people from getting it, but just the not eating for a full day beforehand and then having to do the whole cleanse. I just felt very proud of myself afterward, and I had nice, clean results, which is even better. But yeah, I really was, that was a major win, getting it done and having healthy results. There's nothing more I could ask for. So again, keeping it on topic, that's a major win for me this week.
That's really good. I'm really glad. And it is one of those things that you just got to do. Like adulting is hard, but we got to do it.
Right. Let this serve as a PSA to schedule those appointments despite our busy schedules, because it matters.
Yeah, you need to take care of yourself first. So, well, thanks everybody for listening. We'll catch you next time. Thanks for joining us in the Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review us. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@vetmedics.com. Veterinary Breakroom is a VetMedics production produced by Alexis Ussery and co-hosted by me, Dr. Alyssa Watson, and Dr. Beth Molleson.